The global health community is fixed on an unprecedented epidemiological puzzle that spans from the remote waters of the South Atlantic to the southernmost city in the world, Ushuaia, Argentina. A deadly outbreak of hantavirus aboard a Dutch-flagged expedition cruise ship, the MV Hondius, has triggered an international tracing campaign and sparked a bitter dispute between local and federal health officials over the origin of the contagion. As tourists disembarked and fled the region amid fears of a spreading lethal pathogen, the incident has highlighted the unique risks of rare viral strains in isolated environments. The vessel departed Ushuaia on April 1, 2026, embarking on a route through remote Atlantic islands and Antarctica, carrying 88 passengers and 59 crew members representing 23 nationalities. Within weeks, multiple individuals fell critically ill, leading to deaths, with laboratory testing confirming that the culprit is the highly dangerous Andes virus. Hantaviruses are a taxonomic family of rodent-borne viruses that typically infect humans through the inhalation of aerosolized particles from infected rodent urine, feces, or saliva. While most hantavirus strains globally do not spread between humans, the Andes variant, which is native to specific regions of South America, is uniquely capable of person-to-person transmission under close contact conditions. When contracted, the virus can lead to hantavirus pulmonary syndrome, a severe respiratory illness that causes the lungs to fill with fluid, rapidly progressing to acute respiratory distress syndrome, pneumonia, and shock, carrying a historical mortality rate that can reach up to 40%. The clinical timeline of the outbreak details a swift and tragic progression. According to reports from the World Health Organization and national focal points, the index case involved an adult male passenger who developed a fever, headache, and gastrointestinal symptoms on April 6, just days after leaving port. By April 11, his condition deteriorated into severe respiratory distress, and he died while the ship was at sea. On April 24, an adult female passenger, who was a close contact of the first victim, was moved ashore at the British Overseas Territory of St. Helena before deteriorating during an evacuation flight to Johannesburg, South Africa. A third passenger, an adult male, presented to the ship's doctor with pneumonia symptoms, prompting a critical medical evacuation from Ascension Island to an intensive care unit in South Africa on April 27, where polymerase chain reaction, or PCR, testing officially confirmed hantavirus infection on May 2nd. A fourth passenger died on May 2nd after showing symptoms for less than a week. In response to the growing crisis, the Argentine Health Ministry dispatched specialists from the state-backed Malbrán Institute to Ushuaia to conduct intensive rodent trapping in the surrounding forests and landfills. Federal authorities initially hypothesized that the first victims, a Dutch couple passionate about birdwatching who both died of the illness, contracted the virus while visiting a waste site in Ushuaia. However, local authorities in Tierra del Fuego province have vehemently rejected this claim, calling it a smear campaign that threatens a tourism sector responsible for 25% of the city's revenue. Juan Petrina, the director of epidemiology and environmental health for Tierra del Fuego, stated that the likelihood of local infection is almost zero, noting that the province has never recorded a single hantavirus case. Local officials emphasize that the ship maintains strict rodent control protocols, including external audits and anti-rodent discs on its mooring lines, and suggests that the victims likely contracted the virus while traveling through central Patagonia or northern regions, where the long-tailed pygmy rice rat, the primary reservoir for the Andes strain, is endemic. As the MV Hondius traveled toward its final destination in Rotterdam, Netherlands, former passengers were placed under quarantine or hospitalized across a dozen countries, including Canada, France, Germany, the United States, and Australia. Public health guidance regarding hantavirus focuses heavily on environmental management and tracking. For passengers and crew members associated with the voyage, international agencies mandated an active symptom monitoring window of 45 days, along with strict hand hygiene. Onboard prevention protocols require thorough environmental disinfection and specific ventilation practices, with explicit instructions to avoid dry sweeping, which can kick up latent viral particles into the air and cause accidental inhalation. Epidemiologists note that while the panic regarding a wider global epidemic has subsided, the limits of current knowledge remain a challenge. Scientists are still conducting viral sequencing and metagenomics to understand the precise genetic profile of this outbreak, though current data points to a single zoonotic spillover event followed by localized human transmission in the crowded, enclosed quarters of the ship. The World Health Organization has reassessed the global public health risk as low, given that previous outbreaks of the Andes virus have remained self-limiting and restricted to close contact environments. In Ushuaia, local field teams continue to analyze the captured local rodent subspecies to definitively rule out the presence of the virus in Tierra del Fuego, an effort gaining urgency as environmental scientists observe climate change altering the geographical range of disease vectors worldwide. For continuous coverage on global health security and breaking public health reporting, consider subscribing to this channel. The clinical and epidemiological timeline of the outbreak details a swift and tragic progression of cases across multiple international jurisdictions. According to official reports from the World Health Organization and national public health focal points, the index case involved an adult male passenger from the Netherlands who developed a sudden onset of fever, headache, and gastrointestinal symptoms on April 6, 2026. Just 5 days after the vessel departed the port of Ushuaia. By April 11, his condition rapidly deteriorated into severe respiratory distress, and he died while the ship was in transit at sea. On April 24th, an adult female passenger, who was a close contact of the initial victim, was moved ashore for emergency stabilization at the British Overseas Territory of St. Helena. However, her condition deteriorated fatally during a subsequent medical evacuation flight to Johannesburg, South Africa. A third passenger, an adult male, presented to the ship's medical team with severe pneumonia symptoms, prompting a critical, high-risk medical evacuation from Ascension Island to an intensive care unit in South Africa on April 27, where real-time polymerase chain reaction testing officially confirmed a hantavirus infection on May Sook. A fourth passenger, whose identity remains undisclosed by maritime authorities, died on May 2nd after manifesting acute respiratory symptoms for less than a week, underscoring the aggressive nature of the pathogen. In response to the growing crisis, the Argentine Health Ministry dispatched specialized epidemiologists and field biologists from the state-backed Dr. Carlos Malbrán National Institute of Infectious Diseases to Ushuaia to conduct intensive rodent trapping and environmental sampling in the surrounding subantarctic forests and urban municipal landfills. Federal health authorities initially hypothesized that the first victims, a Dutch couple passionate about birdwatching who both succumbed to the illness, contracted the virus while visiting a waste disposal site on the outskirts of Ushuaia prior to embarkation. However, local health authorities in Tierra del Fuego province have vehemently rejected this hypothesis, characterizing the federal claims as an unsubstantiated smear campaign that threatens a vital tourism sector responsible for 25% of the city's economic revenue. Juan Petrina, the provincial director of epidemiology and environmental health for Tierra del Fuego, issued a formal statement indicating that the probability of local infection is almost zero, noting that the province has never recorded a single native hantavirus case in its documented medical history. Local officials emphasized that the MV Hondius maintained rigorous, audited pest control protocols, including certified external sanitary inspections and the mandatory installation of mechanical anti-rodent discs on its mooring lines while docked. They suggest instead that the victims likely contracted the virus during pre-cruise travel through central Patagonia or northern Argentine provinces, where the long-tailed pygmy rice rat, the primary zoonotic reservoir for the Andes hantavirus strain, is historically endemic. As the MV Hondius proceeded under strict maritime quarantine toward its final scheduled destination in Rotterdam, Netherlands, former passengers and crew members who disembarked at intermediate ports were placed under mandatory isolation or specialized hospital monitoring across a dozen countries, including Canada, France, Germany, the United States, and Australia, as global health networks scramble to track every potential contact. Public health guidance regarding hantavirus control and containment centers heavily on aggressive environmental management, rigorous contact tracing, and targeted behavioral precautions. For passengers, crew members, and transport personnel who were exposed during the voyage of the MV Hondius, international health agencies have mandated an active daily symptom monitoring window lasting 45 days from the date of last potential exposure, paired with strict protocols for hand hygiene and personal protective equipment. Onboard prevention mandates require comprehensive environmental disinfection of all common areas and cabins using specialized virucidal agents capable of disrupting the viral envelope. Public health authorities have issued explicit instructions to avoid dry sweeping, dusting, or vacuuming in potentially contaminated spaces, as these actions can disturb settled rodent excreta and kick up latent viral particles into the air, leading to accidental inhalation of the dangerous aerosolized pathogen. Standard protocols dictate that surfaces must be thoroughly wet-cleaned with a diluted bleach solution or an equivalent disinfectant to completely neutralize any viral presence before removal. From a clinical perspective, the practical takeaway for travelers visiting endemic regions is to exercise heightened vigilance in rural, forested, or poorly ventilated structures, ensuring all food supplies are stored in rodent-proof containers and any signs of rodent infestation are handled with extreme caution. Epidemiologists note that while the acute panic regarding a wider global epidemic has subsided, significant limits in current scientific knowledge remain a challenge for global health security. Genomic laboratories are still actively conducting viral sequencing and deep metagenomics to understand the precise genetic profile of this specific viral line, though current data heavily points to a single zoonotic spillover event from a wild reservoir followed by localized human-to-human transmission fueled by the crowded, enclosed quarters of the maritime vessel. The World Health Organization has reassessed the broader global public health risk as low, reassuring the public that previous historical outbreaks of the Andes virus have remained self-limiting and structurally restricted to close contact environments rather than triggering sustained community spread. In Ushuaia, local field teams continue to analyze biological samples from the captured local rodent subspecies to definitively and scientifically rule out the presence of the virus in Tierra del Fuego, an effort gaining immense urgency as environmental scientists observe global climate change altering the geographical ranges and migration patterns of disease vectors worldwide. Ethical reporting during such an incident requires a careful balance between transparency and public calm, ensuring that panic does not outpace verified laboratory data or unfairly devastate local communities dependent on seasonal industries. As the investigation transitions from emergency response to long-term surveillance, health officials emphasize that informed awareness, rather than border closures or economic isolation, remains the most effective defense against emerging zoonotic threats. For continuous coverage